Good morning, I am Matteo Di Gioia from the orthodontic practice Di Gioia Martinetti. Today we will talk about a type of bite that affects many patients, namely deep bite, which is when the upper teeth excessively cover the teeth of the lower arch. Recently, this has been added to the list of causes responsible for increasing the likelihood of discomfort in the jaw joint, the temporomandibular joint, since deep bite forces our mouth system to work extra, causing hyperrotation of the mandible when opening. So basically, it's one of those situations that is worth improving. For example, by using aligners to move from this situation where the lower incisors are much higher compared to the back teeth. Here, clearly shown by this red line, you have a situation where all the teeth are at the same level. As shown in the photo on the right, highlighted with the green line, correcting a deep bite can also be done with aligners. Some colleagues say that it's not possible or that it's difficult. Today we'll look at an extreme case of deep bite correction with aligners. It always starts with a case study. So collecting data, facial photos that allow us to assess where the midline is. Profile photos from above to see how the teeth are inclined in relation to the face and thus decide how to move them. You can see this is the initial situation, a very pronounced deep bite. You can see the lower gum in contact with the upper and lower incisors. You can see that they are all wearing down, being abraded. Look at how flat they are, how much they are forced to touch against the gum and the upper teeth in a rather forced way. And this leads to premature abrasion, in addition to this extra work at the joint level and beyond. It can also sometimes create pockets, that is, areas where the gum is not well positioned. In this particular case, at this level, in terms of closure, it is quite good for this patient. Let's say that the posterior lines should coincide to be ideal, even on the left side in line, facing the cusp, what is called the anterior buccal side of the upper first molar, it should close. Where this green line is, we are very close. This is the upper arch seen from below, where you can see a slight misalignment of the upper teeth. This is simple to correct. And the lower teeth, quite obviously, being trapped completely inside the upper ones, tend to end up being a little bit crowded and also noticeably tilted backward. This is the panoramic view where the difference in level is clearly visible. The step between the back teeth, which you can see are lower in yellow, and look at the front teeth and the incisors where they are. There is this over-eruption of the incisors, which leads to extra work and excessive wear of these teeth. In addition to these discomforts that may arise, if you also add, for example, bruxism or parafunctional activities, in short, they wear down much more quickly in addition to causing discomfort at the level of the jaw joint. This is always part of the case study. The cranial X-ray, a lateral view of the patient, where you can see that this patient is also difficult to correct, and it is hard to fix the deep bite because we say that this is a patient who tends toward hypodivergence, meaning they have a compressed face, so strong muscles that work against our clear aligners. So it's a complex case, both because of the amount of over-eruption of the incisors and the shape of the patient's skull. This is the treatment simulation where we actually simulate the movement of the teeth. And you can clearly see the step that forms between the lower teeth, the incisors, and the posterior teeth with the incisors completely hidden. This is the simulation where these red things are called attachments. They are used to interact with the aligners and create this system of forces that moves the tooth. See how the incisors are pushed down to make them level with all the other teeth. This helps prevent them from wearing down excessively and also brings the gums back to their optimal level. You can see the attachments are on almost all the teeth, precisely to help us create that system of forces needed to move them. You can also see there are some little numbers. These numbers at 0.4 represent the amount of stripping, that is, the space to be created between one tooth and another, so that we can move these teeth. These red areas we saw earlier instead represent the contacts that we are going to create at the end of the treatment. This particular image illustrates the significant expansion of the upper dental arch with the final and complete contacts, and this subsequent image clearly demonstrates the precise amount of movement of the lower incisors. So, at this point in time, we are now going to carefully observe and thoroughly evaluate if, in actual reality, we have indeed achieved precisely what we meticulously simulated and planned. After 7 months, we finished these initial aligners, which were 31, and let's see what the result is. This is where we end up. Look at how they've been flattened, how it's been flattened, as they say. The curve of Spee, or the front teeth, how they've moved downward. And the fit, of course, has been maintained because it was good. In fact, it's been improved. The teeth are now practically straight after just 7 months. It's said that this space between the upper and lower teeth has increased a bit. It's called overjet. There's still a little room for improvement, but you can see that now the lower teeth are completely visible. They're no longer covered by the upper ones, so the mandible, for one thing, they don't wear down because, as you can see, they're now separated from the upper teeth. And then the mandible can work more gently and is less stressed. Look at the change in just 7 months compared to the initial situation. Thank you. And after just 7 months of treatment, this is something that's very hard to achieve even with fixed braces. A result like this is truly remarkable in orthodontics, so now we'll do some finishing touches. It's called a refinement. There's an additional series of aligners where we further improve the fit to close up the small gaps that remain, and these are the final photos. After just 13 months of treatment, that means only a year with clear aligners. This is the patient's smile, happy to have improved even further. The edges, called the incisal edges of the front teeth, which have worn down due to excessive use, should ideally be slightly rebuilt. The profile was already good, of course we kept it that way, and look, this is the initial situation, those lower teeth that you can't see. And after 13 months, you can see that now they're clearly visible, they no longer touch against the gums and the upper teeth, and the bite has been resolved. Deep bite, initial situation with these lines that didn't match up perfectly. And in the end, they line up just as they should. Textbook style, it's called first class, and also on the left side. These are the final photos with the back lines that match up perfectly, so both in terms of how the teeth fit together and in terms of alignment. Now you can see how beautifully aligned they are. The teeth are practically, I would say, perfect. But above all, in terms of the deep bite. Look at the difference there was between the teeth, how they were at the beginning. Look, they were several millimeters higher than the lower ones, I would say about ½ a centimeter, and now they're all at the same level, so it can be done with aligners. Even radiographically, you can compare the initial situation with the final result. You can see how this front group of teeth has lowered. So our patient is obviously very happy. Whenever he wants, we can also go ahead and restore these worn edges of the front teeth to further improve aesthetically his smile. And of course, we too are extremely satisfied to be able to resolve complex cases quickly, making the treatment more manageable for the patient with aligners, so in a transparent and barely noticeable way. However, we can only achieve this by having an in-depth knowledge of the system, the technique, the biology, and the biomechanics of aligners. Because these are certainly not simple treatments, but as we have seen today, it is possible to correct bites. Deep, significant ones with transparent aligners, so contact your trusted orthodontist who will be able to help you, and give us a like if you enjoyed the video. See you next time.